Hello, everyone. I'm Victoria Spataro, and I want to start off with a simple question that I've been asking myself for a while now. Should access to healthcare really depend on your paycheck? Today, let's dig into why that answer should be absolutely not, and what we can do to make healthcare a right and not a privilege. Let me paint you a picture. You're at a pharmacy, you have a prescription that you need. You're staring at the register, doing mental gymnastics. Can I afford insulin and my rent this week? That's not some dramatic scenario, it's real life for millions of people across this country. Right now, over 27 million Americans don't have health insurance, and even more have coverage that doesn't actually cover them. Nearly half of adults report medical debt. That means your neighbor, your coworker, maybe even you are having to choose between keeping the lights on and picking up your prescription that you need. And you know what? Dr. David Stewart said it best. Healthcare should not be a luxury for the privileged few. This isn't just a policy failure, it's a national failing, and it is personal. Here's the irony. The US spends more money on healthcare than any other high-income country. But we don't get more healthcare. We don't get more fairness. Instead, we get a system riddled with holes, fragmented coverage, sky-high costs, and communities, especially communities of color, left behind. According to the Commonwealth Fund, we rank near the bottom in access and equity. Florence and her team found that people with the least resources are hit the hardest. That's not just inefficient, it's unjust. Now, I know what some folks might be thinking. National health insurance sounds expensive. You won't be able to choose your doctor. Isn't that just government-run rationing? But let's talk facts. Study after study shows a national plan would actually save billions of dollars. We're talking reduced admin costs, bulk drug pricing, streamlined care. And as for choice, look at countries like Canada. People still pick their provider, still get care, just without the stress of bankruptcy. And rationing, that's already happening right now, but it's based on your income. That's the harshest kind of rationing. Florence's research shows we could save billions just by negotiating drug prices and cutting waste. But the real price? It's human. Ask the cancer patient who had to skip chemo because the bill was 10 grand. That's not rationing based on health need, that's rationing based on wealth. And we have to flip the script. So let's talk about what could be. A national health insurance program that covers essential medical care for every American. Primary care, emergency care, all of it. Automatic enrollment, fair funding based on what people can afford, and still having a choice. You'd still get to pick your provider. This isn't some distant dream. It builds on what works and fixes what doesn't. Picture this. No parent losing sleep over how to afford their child's fever. No young adult skipping care because their deductible is absurd. Communities with longer lives, stronger families, and fewer disparities. And here's what the Commonwealth Fund says. Universal healthcare is a public health tool as powerful as vaccination. I couldn't agree more. Here's where you come in. Send an email to your legislators and ask them to co-sponsor for Medicare for All Act. Call their offices, yes, old school style, and ask them to take a stand. Schedule a sit-down, meet with their health staffers, share your story or someone else's. If they've already co-sponsored, amazing. Thank them and encourage them to speak louder. And finally, team up with groups already doing the work, local chapters, national organizations, student-led campaigns. This movement's stronger when we build bridges. Because if we're serious about dignity, health, and justice, we don't settle for the current system, we change it. Together, we can create a country where no one is punished for being sick, and every person gets access to fair health care, not just the ones with money. Thank you.